Hello friends, my name is Pratik, doing first year MBBS from Sri Satya Sai Medical College. Today I am going to explain you about Duchenne muscular dystrophy. Dystrophy, dys means bad and troph means nourish. So muscular dystrophy in general refers to muscle appearing poorly nourished because of degeneration causing muscle weakness. Under microscope, biopsy of tissue shows changes in muscle tissue itself, but not in nerve or neuromuscular junction. Therefore, muscular dystrophy completely differs from other diseases caused by nerve damage. Muscular dystrophy is actually a group of disorders caused due to genetic mutations. Within the group of disorders, dystrophinopathies are most common. Dystrophinopathies include Duchenne muscular dystrophies or Becker muscular dystrophy, both of which result from mutation of dystrophin gene and are allelic disorders. Dystrophin gene mutation can lead to first absence of dystrophin protein that may cause due to nonsense mutation or frame shift mutation leading to Duchenne muscular dystrophy, and second is misshapen dystrophin due to missense mutation that lead to Becker muscular dystrophy. Now, speaking about Duchenne muscular dystrophy is more severe than Becker muscular dystrophy. There is complete absence of dystrophin, and symptoms of Duchenne muscular dystrophy are more severe than Becker muscular dystrophy. Speaking about the dystrophin gene, it is the huge gene represented on X chromosome that has 79 exons and 2 million base pairs in them. For comparison, a normal any chromosome has 10 exons and 50,000 base pairs. So, dystrophin gene has more base pairs and exons. There is more probability of mutation as the base pairs and exon is very high in number. These mutations are generally deletion or duplication or sometime point mutation. Now, as we know that male have one X chromosome and one Y chromosome, and female have two X chromosomes. This means that muscular dystrophy is more common in male because they have only one copy of dystrophin gene, and if that copy is defective, it is the only one available to the muscle cell. On the other hand, women has two sets of X chromosome, and there won't be any problem if one X chromosome has been affected. So, Duchenne muscular dystrophy is more common in males. As this disorder is related to X chromosome, this is X-linked disorder. Now, dystrophin protein, this is the main protein of muscle which links intracellular actin with dystrophin associated protein complex, which are the cluster of cytoplasmic cell protein that are anchored to extracellular matrix around the muscle. As dystrophin protein makes the linkage between intracellular actin and extracellular matrix, it stabilizes the sarcolemma. Without the support of dystrophin protein, the sarcolemma does not get support and eventually wilts. As it is already wilted, over time cellular proteins like creatine kinase start escaping from the cell and calcium start entering the cell. As calcium enters, the cell eventually leads to death. In a while, muscle try to regenerate muscle fibers of different sizes. They lead to atrophy of muscle that leads to their weakness. All these factors like fibers of different sizes and atrophy of muscles eventually leads to death of muscle or muscle cell death, and causes muscular dystrophy. And in Duchenne muscular dystrophy, as there is complete absence of dystrophin protein, this is more severe in Duchenne muscular dystrophy. Duchenne muscular dystrophy is generally noticed in legs of children. They have waddling gait and calf pseudo hypertrophy. They have visible calves enlarged due to fat and fibrous tissue than muscle tissue. Other sign noticed in Duchenne muscular dystrophy is Gover's sign. If the patient is lying down on their flat stomach, they slowly try to stand up, holding their feet and holding the ground, and they will try to stand up. As their hips and the muscles of the thigh are weak, they will feel a bit difficult to stand up without any support. Now, There are various other symptoms, later symptoms, we can say them later symptoms, which include in future patient may use wheelchair as due to severe weakness. Second, developing respiratory failure due to weakening of diaphragm. Third, scoliosis. Fourth, dilated cardiopathy and arrhythmias. As dystrophin also expresses in heart muscle, we can see dilated cardiomyopathy and arrhythmias. Overall, it leads to reduction of lifespan. For diagnosis, people with Duchenne muscular dystrophy often have high creatine kinase level. So a person can go and the suspected patient can test for creatine kinase level, and diagnosis can be confirmed by looking up for mutation in the dystrophin gene in DNA test or Western blot or by muscle biopsy. Unfortunately, there is no treatment for Duchenne muscular dystrophy or Becker muscular dystrophy, but glucocorticoid can sometimes slow down regeneration. They have some side effects like weight gain. Even though we can use glucocorticoids to slow down effect, they have got some side effects. So patients should never lose their hope. There is physical therapy are also available. Conditioning can improve the condition. So my take-home message is fight Duchenne muscular dystrophy. Be a researcher of Duchenne muscular dystrophy. Better lives through Duchenne muscular dystrophy research. And always, I love the shirt that say, I know a fighter, not a defeater. Thank you.